extend the statewide mask mandate. Let's listen to the governor.
Again for another weekly update. Today we have another full lineup, including more about a new effort that will launch later yet this month, before the month's end, with our long-term care facilities statewide. I'm joined by Dr. Weaver today as Dr. Box continues to recover and recoup at home, appropriately so. But Dr. Weaver will provide us with an update on our hospital and ICU capacity, our positivity rates, and our county metrics map, as well as she will discuss our vaccination plan when they become deployable. And I also think you're going to touch on some ongoing contact tracing efforts and challenges that we've been experiencing really since the outset when we started that. Dr. Box is going to, thankfully, join us by phone. I guess you can't keep a good doctor down, and she's not wanting to be down, but I'm just so pleased that she is able to join us for an update on how she and her family have been getting through this, and really walk through some contact tracing issues and how they've worked for her family personally. And then we'll also hear from the Director of Homeland Security, Director Steve Cox, who is going to join us by telephone as well. He's in Elkhart County right now meeting with local officials and local emergency personnel to learn more about what we can be doing as a partner with Elkhart County and those first responders, those folks who are on the front line. We want to make sure that we're able to address any surge surgically and with precision. Also, last week, I said we'd be back this week to talk about where we stand as of today. Our numbers continue to rise on two main fronts, the 7-day positivity rate, of which Dr. Weaver will talk about, and our hospitalizations. You'll see in just a moment that our county metrics map has a lot less blue this week than it did a week ago. And there are some counties that were red a week ago that are no longer red. That just goes to show you how our rate and spread moves up and down, ebbs and flows all over the state of Indiana. And what was blue one day is not the next, and what was red one day is not the next. This is fluid. And so that's how we have to, again, address this in this fluid situation. That's why I'm asking and continue to ask Hoosiers to do what you know works. And we know a lot more now than we did in March about this coronavirus and COVID-19 specifically, and we know what precautions actually work. We know good old-fashioned Hoosier hospitality is what's really in order in our daily lives. It's not just to protect yourself, it's also to protect your spouse, your husband or your wife or your grandparents or your neighbor or the waiter or waitress at the diner that's taking your order, someone that you don't really know but you're interacting with. So please continue to practice these best practices. Wear a mask, distance when you can't wear a mask, or when you're far enough apart that you don't have to wear a mask. Again, they work, and this is up to us to try to control everything that is in our power to control. And to put a fine point on it, it's especially important for the main topic of our discussion today. Before I do turn things over to Dr. Weaver to get more into the weeds, we are introducing today additional efforts in the coming days in our long-term care facilities all across the state, statewide. We knew in the early days, I think Dr. Weaver and Dr. Box both addressed this at the very first time we got together, that the adverse and disproportionate impact that COVID-19, this pandemic, would have on seniors, especially those with underlying health conditions that are particularly susceptible to COVID-19. And here we sit today and we look at the data, and it tells us that 75% of all positive cases cases of death are with individuals who are 70 years old or older. And we also know that over 50%, about 55% as it was yesterday, are occurring in our long-term health care facilities, residents of those facilities. So this is not unique to the state of Indiana. Doesn't make it any easier to deal with, but it's happening across the nation just because of those traits that I've just described and those underlying health conditions. Again, from the very, very beginning, Dr. Box and her team have operated with a sense of urgency to assist those long-term care facilities, sending in, as you'll recall, and Dr. Weaver talked about this a couple weeks ago, sending in those strike teams to test and reinforce infection control measures, providing PPE, working with the facilities to keep residents and their families informed about cases in hopes of that equipped with that information would help reduce the spread and reduce the COVID-19 transmission, and creating visitation protocols and so much more. But we've really been doing this since the very, very beginning. Still, again, deaths and cases continue to mount at these facilities. Several weeks ago, Dr. Weaver, you shared that there would be a push this month to get our teammates out to complete inspections and do surveys in every facility, about 535, or you might talk about exactly how many. But what we learned there is that we need to initiate an even more targeted, surgical if you will, but an even more targeted effort to support and protect residents where they are. And that means the staff, and that means families of those residents. And they're simply like so many, overwhelmed by the scale and pace that this virus can really take on. And we appreciate everything that they're doing. There is fatigue there. You're seeing that. We're hearing that when you're on the ground. So over the next couple weeks, we'll take additional steps to directly support and further partner with these facilities, starting with utilizing members of the Indiana National Guard who will work side by side, staff members, and help them with screening employees and data entry and testing and infection control practices and again, so much more, so that the facility staff members can rightly focus on what they do best, and that's caring directly for the residents. We'll also hire additional clinical staff from among those who have already stepped up long ago, stepped forward and said, put me in, I want to help. I may be retired or I may be new at this, but I want to help. And so we'll continue to put them in, just exactly what they asked to do, as part of our reserve workforce, to visit all of these facilities several times a week to train employees and further train employees on the most up-to-date best practices. And we'll start with facilities, this may sound like a no-brainer, but we'll start with facilities that already have a registered outbreak. And just so you know, I mean, an outbreak by definition is one case. And so we're going to be getting out all over the state of Indiana, starting with those long-term care facilities that already have a registered outbreak. In addition, the state is going to send a lot. I'll leave it to you to go into the details. We're going to be sending a lot of additional PPE, N95 masks and gowns and face shields to all the long-term care facilities, as we have in the past. But this is going to be, again, kind of surgically meeting that surge with our surge of our own for all of those patient-facing staff members to wear when interacting with residents. We're working to put these pieces in place beginning November 1, and we'll do this for the remainder of the year, and we'll constantly assess our progress, and then we'll be very transparent about that as well, how it's going. The pandemic has taken a toll, as I just mentioned, on all of us, but it's taken a real toll on the residents and the staff and both of their families. And so this, again, is just another step, what we've learned through these surveys of how we can further help on the ground in local communities all over the state. Our goal is obviously, the bottom line is to provide some relief for the staff members and the residents, slow the spread among them, and educate and improve all of those known to be working infection control procedures. And by the way, slowing the spread of this infection and sickness inside these facilities there's a direct correlation between how that also impacts our hospitalization rates. You may scratch at that as well, but what happens in the community that ends up in the facility ends up in a hospital. So it's all the same stream. It's either upstream or downstream, no matter where you are, but it's all interrelated. And so it's just critically important that we're there, partnering with them and doing all that we can. And we've always used the resources as one of our key measurements: PPE, testing, tracing, capacity, and we'll continue to do that, even localized here at these long-term care facilities. As I just mentioned, we have seen an uptick in our positivity rate and our hospitals in recent weeks, as we see around the country. Nearly 40 states are fitting into this category. So we know it's not just happening here, it's happening virtually almost everywhere. And if it's not happening somewhere, odds are it will be. That's what you see as this virus ravages its way around the world. So if we can prevent infections in our nursing homes, we will protect our hospital capacity and in turn our capacity to care for others as well, both in short-term and long-term, on both fronts. One other thing before I do toss it over to Dr. Weaver and yield the floor. This is somewhat unrelated to the topic of the day and our long-term care facilities, but Janet and Henry, I need to include, and I have decided that in the interest of safety, unfortunately, I have mixed feelings about this, but we're not going to host Halloween this year at the residence, so no trick-or-treating at the governor's residence this year. We're going to try to make that up somehow, some way, creatively in the future. Obviously, we're a little disappointed. There's a way to creatively get at doing this, but somewhat disappointed just because this is one of the real fun things that we get to do and to share with the community. I already had my costume planned out. If you watch Netflix and Stranger Things, I thought that was an appropriate series this year. Has some Indiana connections and even had the character picked out that I was going to go as. But that will be for another day, and there will be another season for Stranger Things as well, and come what may next year. And so we're planning on donating our candy that we've accumulated for the big day to a worthy cause, and hopefully that'll put a smile on someone's face. I know, Doctor, you'd probably say pass out vegetables and fruit, but everything in moderation, right? And I bet your kids get some treats along the way too. So with that, I'll turn it over to you, and then we'll go to Dr. Box, and then we'll go to Director Cox.
And as you just heard, Governor Holcomb giving us a couple of different updates. The first, more resources to long-term care facilities, specifically the ones who have registered outbreaks. Also asking Hoosiers to continue to wear their masks. And of course, if you want to continue seeing this update and this briefing, we have it for you right now on wishtv.com as well as on Facebook. And of course, we'll have more for you on these updates on Wish TV at 5 and 6, and we'll be with you at 4 for All Indiana.